morning, and welcome everybody. Welcome to this session. My name is James Manyika from Google, and I'm here joined by two incredible people who I think you're going to enjoy. First by Firth-Butterfield, the CEO of Good Tech, and Dean Lloyd from Stanford's School of Medicine. I should actually say a little bit more about each of them because they're quite remarkable individuals. Kay, as I said, is the CEO of Good Tech, is a Time 100 Impact Awardee in 2024. She's also former head of artificial intelligence and member of the executive committee at the World Economic Forum. And she's also on the advisory board of UNESCO's International Research Center on AI. And she's considered one of the foremost experts in the world on the governance of AI. Lloyd is a scientist, surgeon, and academic leader. He is the Carl and Elizabeth Norman Dean of Stanford University School of Medicine and the Vice President for Medical Affairs at Stanford University. As Dean, Dr. Miner has had a pretty key role in setting the strategy for the clinical enterprise of Stanford Medicine. And also under his leadership, Stanford Medicine leads the biomedical revolution in precision health. And in 2021, Lloyd began realizing a bold vision to transform the future of life sciences at Stanford University and beyond. So I'm delighted to have the two of them. Please help me in welcoming Lloyd and Dean. And, you know, I'm looking forward to this session because the focus of this session is around reimagining health in the age of AI. I think if some of you were here in the previous session, I mentioned some of the three things we've been doing, particularly in the last 3 weeks. Some of the work on connectomics, trying to create a map of the human brain using AI, AlphaFold 3 on understanding life's kind of biomolecules, and then also the work on Gemini. So that's just a backdrop. But I thought where we would start with this conversation is to a bit of a personal journey, get to know each of you a little bit. And Kay, I'm going to start with you. So how did you find your way into AI? And say more about the work and the idea for Good Tech. Where did that come from?
Yeah, sure. Thank you, James, and thank you for having me. I was a lawyer and a judge and a professor, and so I really feel that my life was sort of organized to get me to this point of working with AI and responsible deployment and development of AI, because it's really about caring. You know, when you're a lawyer or a judge, you're helping one or two people at a time. When you're a professor, you're helping many students, hopefully fledge and have a fabulous life. And then, you get to this point where what I want to do, as you were saying in the last panel, is really just sort of ensure that we use AI wisely and we get all of its benefits. So what does Good Tech Advisory do? It helps organizations, big and small, around the world, really think through how they are deploying AI for all of its benefits and mitigating those risks. And then obviously I'm still doing all that work with the UN and the OECD and others, because this is something that we need to think of as humanity and planet-wise.
Yeah, and I know we're going to get into that a lot more, but I wanted just to follow up quickly. I mean, you've been doing this for quite some time. Do you think the trajectory has changed? I mean, the urgency or the importance or around these issues in your mind?
Absolutely. I was the world's first chief AI ethics officer in 2014, and it felt as if there was DeepMind and me and a few others pushing the rock up the hill. But now, especially since generative AI, the conversation has changed, and we are all now, I think, much more focused on what we need to do.
Yeah, we'll come back to a lot more of that. Now, Lloyd, you've been an incredible transformational leader at Stanford. What excites you the most about the intersection of AI and medicine? And also, how do you see your role, especially as the dean of this incredible medical school, encouraging or discouraging? I don't know how you think about that connection between AI and medicine.
Thank you. Well, James, thanks for inviting us here today. And I think you summarized a lot of the things that are exciting about AI and biomedicine. The work that's going on through Google with AlphaFold 3, the Gemini project, really every aspect of biomedicine, healthcare, I think is going to be transformed and changed. Hopefully, and if we do it right, in a very, very positive, impactful way, all the way from fundamental discovery science up through the way we deliver healthcare and making our healthcare delivery system, particularly in the United States, much more efficient than it is today. You know, we spend about 20% of the healthcare dollar in the US on administering the system. So dollars spent not related to the delivery of care or to the frontline people who are involved in the delivery of that care, but dollars spent just administering this very, very large component of our GDP. That's all ripe for transformation by AI. But also, I think just looking at how we practice medicine, how we interact with patients. You know, the bane of every primary care physician's existence is typing into the electronic medical record. And there's nothing more frustrating or dehumanizing for a patient going in to see a healthcare provider than to have that provider immediately start typing in a note for documentation. And look, the alternative is that provider is going to spend 2 or 3 hours at the end of the day catching up on documentation. You know, the deployment of ambient AI to take that step out of having to type in the note, but actually having a note of the encounter prepared before it's even over so that the healthcare provider and the patient can review it and check it for accuracy. That's really going to be transformational both for healthcare providers and also for patients. But essential to all of that in the healthcare delivery space is going to be building the trust, as Kay has so importantly mentioned and studied, building the trust in the public and in providers that AI is going to do what it's set out to do, and that we're going to protect the privacy of individuals involved.
Yeah, I want to come back to those questions of trust, but I want to just follow up on something you said. You described the idea of ambient AI. I can't resist. Say more about that, and also say, if it's not the same thing, say more also about where in the healthcare process or system do you see AI playing a role? Is it mostly when doctors are trying to type in notes? Is it more than that? Say more about that. Say more about that.
Sure. I think the notion behind ambient AI is that, and many of the people in this audience are working on related topics, is that rather than having to form a documented note of an interaction between a patient and a provider, that the AI, and you know, in your previous session, Jeff Dean was talking about multimodal data. Well, right now, ambient AI systems, some of the ones that we're deploying and studying, obviously are focused on language, what's being spoken in the room, but what about when that is integrated with images, with laboratory results, with all the myriad, with sensor data, and everything gets integrated and assimilated in real time for the patient and the healthcare provider. I mean, that's within our grasp, right? In the not too distant future. That will be transformational because so much energy, time, and inefficiency right now is devoted to humans having to do that assimilation in the midst of 1,000 other things they're doing in the delivery of healthcare.
Yeah, and then you've also talked, when we were talking earlier, you mentioned this idea of physician burnout.
Right.
That happens. Say more about that and how this might help.
I think physician burnout has many causes, of course, and coming out of the pandemic, you know, we talk about the pandemic in the past sense. But it isn't that far away. It had a profound effect on all of us, but it had a particularly profound effect on those of us involved in the delivery of healthcare, because those of us involved in the delivery of healthcare were on the front lines during the darkest moments of the pandemic. And we're still recovering from that. But I think the increased documentation, you know, responsibilities, which well, look, none of us would go back to paper medical records. None of us. There's so many benefits. But the documentation needs and requirements, and as our patients get sicker and sicker, those continue to take time away from the provision of care and actually being involved in tasks that should be handled better, by AI systems and mechanisms.
Right.
So that's one example. You also ask about, well, where else can AI be deployed? Well, in medical imaging, for example, where it already is extensively being deployed. But and even I think a greater impact is in pathology, where now, when a person has a tumor removed, that tumor is very meticulously sectioned and hundreds of slides are made. And then a pathologist sits in a room and very painstakingly goes through each of those slides and assimilates in their brain, the three-dimensional structure of the tumor, and from the visual recognition says this is cancer, this isn't, or the cancer is close to the border here. I mean, that's ripe for machine learning and AI approaches. It's been harder to deploy, at least initially, because unlike radiology data, which is digital when it comes in, a pathology slide is an analog slide, but that's been overcome now with FDA-approved scanners, and now the ML approaches are catching up. And so I think we'll see much more accurate diagnoses. Not that AI is going to supplant pathologists, it's going to make them better learners and also make the process much more efficient.
Fantastic. Well, let's stay with this idea of kind of practical applications. I mean, Kay, a lot of your work focuses on AI in hospitals, and more specifically supporting doctors, care workers, and patient care. What does that actually look like in practice? And what are some early or actual applications you see making a difference?
Yeah, well, first of all, the note-taking. That's really important for all the reasons that Lloyd has said. But, doctors and patients have a very special, human doctors and human patients have a very special relationship, or we should have a very special relationship, because at the moment, when you have a life-threatening disease, you actually want a human doctor and human empathy, and I know systems can appear to be empathetic, but that's what you want, or at least that's what I wanted last year when I found that I had breast cancer. And I was excited that, we could use AI in my radiation treatment, that we could use AI in the radiology and the reading of the scans and getting it absolutely right so the surgeon could operate in the right place. But when it came down to it, just having the text, the number of my surgeons so that we could talk was fantastic. She said, anytime you need me, just text me. And it is that complexity that I think that we're seeing hospitals begin to deal with of how do we make the human doctor more available to the patients? And so I think AI is a way of doing that with the note-taking. I then was 3 weeks ago, I suppose now, at my oncologist because I am totally better, thanks to amazing medical science. Thank you. But you have to keep going to see the oncologist. And she said to me, Kay, I've been thinking about AI and I'm working on this US group of oncologists thinking about AI. And I think it'd be really amazing if we could get AI to help you through your journey with cancer. And I looked at her and I said, I don't think I want AI to help me through my journey with cancer. I think I want you to help me through my journey with cancer. But there are pieces that it's really important that AI can do so that you can talk to me. But if we extrapolate that a bit further, I speak the same language as my oncologist. Whereas if I didn't speak the same language as my oncologist, it would be fantastic to have AI to help me with my journey, because I would then be able to understand each facet, and each facet is complex. And it's complex for somebody who actually speaks the same language as their oncologist. So there are great opportunities, I think, for using AI in those situations.
So you're both, I've been interested in how you both think about this. So you both describe kind of uses that feel like they're in the background, assistive uses, helping to type up notes. You've also described uses that feel like in the, trying to understand images or trying to understand data. Is that the full scope of it? So in other words, I guess what I'm wondering is this simply about reducing costs? Is it also about improving the efficacy and the results and the impact for the patient? Or is it both?
I definitely think for me it's both, because what do you want out of a doctor? You want that empathy piece,
right?
But you also want the doctor to know everything there is possible about your condition, and that's where the AI comes in. That's where the AI can be there to help to make sure that the diagnosis is right, the procedure that you have is right, and really make sure that we don't have the medical malpractice claims that we see, for example. So you can make the doctor into a super doctor using AI.
I agree, both, and I think there's definitely a place for AI interacting directly with patients. For example, there are studies going on now in the area of cognitive behavioral therapy. So we know that cognitive behavioral therapy for certain conditions, such as certain forms of depression, can be very effective. It's an intense experience between a provider and the patient receiving the therapy. Most providers are not going to be able to meet with a patient, certainly not once a day, sometimes not even once a week. But we know that the nudges that are so effective in cognitive behavioral therapy, the opportunity for a person to get real-time feedback, either on their mood or other things that are going on in their life, that frequently is the determinant of the efficacy of the cognitive behavioral therapy. So certainly not displacing a therapist, right. But if in addition to every other week or monthly meetings with the therapist, there was constant access to a well-trained AI system that understood that patient's history, that could provide feedback either to them on their thoughts, on their behaviors, and provide those nudges that can actually help the behavioral therapy be more effective. I mean, that's a value add for the patient and obviously for extending, because we're not going to be able to train enough therapists to really provide on a scaling basis that daily type of interaction. So that would be one example. One of our cardiologists was just remarking the other day that he was out of town and a patient called to ask a question, and they said, well, sorry, your cardiologist is out of town. Could I refer you to someone else? And the patient said, well, doesn't he have a large language model that I could just ask my question to? The answer is no, not yet. But there will be a place, I think, for, just as, we've been asked for years, is Dr. Google a good thing? And my answer is, in most cases, absolutely yes, because our patients come in much better informed, having done in the past a Google search, in the future interacting with a large language model, but they come in much better informed. And yes, sometimes that leads into a direction that perhaps isn't the correct one, but still just the fact that people are engaged with their health, that they're asking questions, that they're learning about their condition, that's inherently a very good thing. And of course, AI will take that to a whole different level from simple search.
And I think that's a great point, because we don't have enough doctors and clinicians in the US, let alone in the rest of the world, as you were talking about earlier. And so if we can provide at least any sort of doctor in certain circumstances, we worked with Rwanda when we were at the World Economic Forum, and where there's one doctor for every 27,000 people. If AI can provide a doctor in those circumstances, then that's a huge progress.
Yeah, and actually on that point, some of our teams have actually been working with NGOs in Latin America, in parts of Africa, for example, on issues like maternal health, where often there just isn't enough support in those places. And so the use of AI-based tools has actually been very helpful because, often the question is compared to what?
Yes.
Of course, if you have the benefit of your doctor who you can speak to in your language and you're in Palo Alto or Mountain View, that's a very different situation than being, as you said, in Rwanda. Say more about that, Kay, just based on your UN work and work at UNESCO. How does that look in different places around the world?
Well, I think, we are unfortunately, as you said earlier, seeing that huge digital divide happening between those people who can access AI tools and those people who can't. And that spreads out into the healthcare. The work that we did was actually pre-generative AI. And what we were doing was seeing whether we could create a chatbot that would triage so that the one doctor could actually attend to the people who were truly sick.
Right.
And it's hard to do that. Easier now, perhaps, that we've got generative AI. But then we have that conversation that we should all bear in mind of, what is good enough? Is it we want to have equitable healthcare for everybody in the world. But if we can't have equitable healthcare for everybody in the world, is AI healthcare good enough for those people who can't have the doctors because they've all moved to the global north and the brain drain, for example? So I think that's a big consideration that we need to be having and discussing at the moment.
I want to come back to you, Lloyd, because in addition to what Stanford Hospital and others do, providing care, you're also advancing research and kind of breakthroughs in the field, and you're also responsible for educating the next generation of researchers and physicians. How are you thinking about those two questions, kind of the frontier of medicine as well as the next generation of doctors and researchers?
Well, the research topics, I think are appropriately attracting a lot of attention right now. And in the last session, Jeff Dean was remarking, well, could you actually, or when will we actually be able to formulate and refine scientific hypotheses based upon AI taking in a lot of existing data and also just how do we do better at keeping track of the scientific literature, which grows at a prodigious pace, and using AI methodologies such as the app that you're going to be releasing very soon, Illuminate. Those are all tangible here today effects at making more efficient and frankly more exciting the research landscape. I think comparatively speaking, there's been much less attention to how AI is going to impact education in general and the education of physicians and biomedical scientists in specific. I think it's going to have a profound impact. And let's just take the education of physicians. We've been gradually, although underscore the word gradually, moving away from a memorization-based curriculum in medical school. I mean, there's just too much knowledge out there. But still, the curriculum is centered around learning concepts, even if you don't memorize pathways, because you can have them in front of you when you're taking an exam. But it's still based upon the acquisition of knowledge and then the retention of knowledge and the ability either to directly put out that knowledge or to use that knowledge to solve problems that you're presented either in the clinic or on a licensing exam. But, if we think of the internet as moving us, making information accessible to multitudes, then generative AI, large language models, making knowledge accessible or forming knowledge, then how should we be educating physicians? Well, for sure we should be educating them on how to use AI. And one of the things that I think distinguishes our medical school in Stanford is that we are a medical school. We're an academic medical center with medical school, 2 hospitals, all on the campus of the university. And during the first 2 years of medical school, the preclinical years, we basically follow the same calendar as the rest of the university. So we have students in medical school taking courses. Many of them are already, have taken a lot of courses in computer science, but taking advanced courses in machine learning and AI, taking courses around the university. And we need to be training, and I think we are training, physicians that are dually or even more than dually educated in multiple different fields. And so that they can be at the front line of deploying the technology, understanding its limitations, but also really helping to transform education and medical education. I think the same is true for scientific education, particularly as large language models begin to assimilate information and form the type of knowledge base that traditionally we would have needed to do ourselves, and that we still should do in some form ourselves as we plan the type of science we're going to do. I think this is incredibly exciting space, and in particular, I'm interested in seeing, more sort of thought leadership or thought experimentation around education, and how, in the field that I'm most directly involved in, education of physicians, education of biomedical scientists, how we think about the opportunity to transform that educational experience. Because when we're educating students, postdoctoral trainees, residents, and fellows, we're doing it for a very limited period of their professional lifetimes. And then they'll be out in the real world for 30, maybe as our lifespan increases longer than 30, 40 or longer years. And, we need to be equipping them with the skills to be lifelong learners. And I think understanding the use of AI is going to be an incredibly important skill.
Right. Does that mean, are you going to be evaluating students differently? I mean, much has been made of AI assistants passing medical exams and this, that, and the other. Would that change the way you think about evaluating students?
I think it has to, but I honestly don't know how it's going to. The other thing that, and I'm so glad we're meeting here today, because with AI, we have the most rapidly evolving field of knowledge, perhaps in ability in human history, right? And we're talking today about its application to the most slowly changing process in field, perhaps certainly in modern history, if not in human history, that is the delivery of healthcare. So how do we reconcile those? Well, what I would say to all the developers here is keep pushing, keep sending in the ideas, and don't be discouraged by the fact that it takes a long time to get things implemented in the healthcare delivery system. So too, when we're talking about medical licensure, it's going to take a long time because licensing of physicians is still done at a state level in the United States. There are national licensing exams, but changing them is a really involved process. So we'll have to leap forward in the way we're thinking and in what we're doing in our educational programs, and then the licensing process, the healthcare delivery process, will need to catch up. But if we don't take those initial steps, and all of you in this room play such an important role in those initial steps, we'll never be able to ultimately do the changes.
Well, I want to explore one area which is very, very important with both of you, just given your experience. Healthcare is one of the areas where I think we would all agree we have to get it right with regards to AI. We have to get it right in terms of risks and privacy and all of these things. How do you think about what in your minds are the key things that we have to get right in healthcare about AI?
Yeah, I think that the first is just responsible AI generally. All the things that we've been talking about for a long time, it applies in spades to medical, the medical area. But I think it's also about education. So obviously, we're in an area where everybody knows something about AI. But I work with a lot of rural hospitals where they'll be saying to me, well, I don't know how to procure AI, or I don't know how the AI might work with my existing systems. And I don't know whether I should be allowing my ER doctors to check their diagnosis with a large language model online, which is open source. And so there is a lot of there's a lot of difference between the various ways in which we see AI deployed and the amount of knowledge. So there's that education piece. We need to be educating people more. And we need to have an understanding amongst all of us that when you are developing something, you're going to have to sell it to a notoriously worried audience. And they're worried about the law, they're worried about regulation, they're worried about someone coming and suing them because they've deployed something new. And so if you've really made sure that your product is integrated throughout with responsible AI, then I think that that's going to be really useful here. The other two things I would say is data. And one of the things that you and I have talked about is, there are still 3 billion people about who don't have access, who don't have access to the internet. And so we don't know anything about their data. And that's going to be a huge problem in us providing equality of care to other countries in the world. And finally, it's got to be trust, hasn't it? We're seeing trust levels plummet in AI across the board. The recent Edelman study, which was a global study, said that people are just not trusting AI. We can't bring the benefits of AI to healthcare if our patients are not prepared to trust that.
So say something more about that. So in the context of healthcare, what would trust look like in your minds?
Well, I think trust, it starts with education, doesn't it? And one of the things that worries me a great deal is that most people, we all know about AI, but most people don't know about AI. And so the things that they're hearing about AI at the moment is that it might affect their election adversely and that it's perhaps causing women to be very worried about how they look and things like that. What we need to do is, through our doctors, through our hospitals, really help the patient to understand how AI can help them. And so it's an education, there's an education component in that to create trust.
Lloyd?
I fully agree. And the fact is, we've been using comparatively crude forms of AI in healthcare delivery for a long time. When we moved away from pen and paper for writing orders for prescriptions and things like that, now with electronic ordering, which is the way almost everything is done today, both in the hospital and the outpatient setting, what a physician is writing in a prescription is being checked in the background by AI. You can't move a decimal point when you're electronically entering a dose of a medication. Unfortunately, you can, and it did happen many times when you were writing it out on pen and paper. That has dramatically reduced medical errors in terms of prescribing errors, just getting the doses right, adjusted for a patient's height and weight and other things, which occurs pretty much in the background now. I don't know that in medicine, we've ever talked about that to patients. We probably should be, because that's a point where an electronic system, crude AI, but nonetheless, it's saved certainly thousands of lives by preventing, medication errors. Now, then, reasoning from that or using that as the foundation, then what value add is there going to be to the deployment of more sophisticated AI? And certainly that the argument can be made, but it has to be done in a conversant way because it's more complicated. And I think what people are most worried about is maintaining their privacy. Certainly the question that we get asked when we're piloting ambient AI systems is, well, what happens to the recording of what I've said? And there we have to be very careful. It's not saved, it's destroyed, but are people really comfortable, confident that that's what's happening? I mean, no one wants to have the fear that what they're saying to their healthcare provider is somehow going to wind up on social media or something. And so protecting privacy is absolutely of paramount importance.
Yeah, because it would seem to me that, the health space is one where perhaps some of these techniques like differential privacy make a difference, because there's some cases where, of course, aggregate data is probably useful, and in fact, you don't even want or need individual data. So but that's a nuanced discussion about privacy, which often doesn't get very far. Do you think we'll get to a place where there's a different way to think about data and privacy in healthcare?
Yeah, Kay, go ahead.
Well, I think from my own experience, I would be happy to share data about my breast cancer if it helped someone else. And in fact, I do share data about my breast cancer because there's a big generational study going on in the UK where we all are sharing data and samples and things like that. And so I think that if people can be sure that their data is going to be used in a specific way for a specific thing, then healthcare is an area where you are more prepared to give up that data. But it's also, I think, different dependent upon the way that your health service works. So in the National Health Service, all of that data is being shared, and you don't have to worry about whether a government might change and your insurance might change. But if you're in a country where that might happen and you might go back to pre-existing conditions, then you're probably much less likely to want to share your data.
That's interesting. So I suppose the role of different systems in different countries also plays quite a bit into how to think about this question. Lloyd, I was glad that you actually spoke to the developers in the room, because there's quite a few of them in the room, and to encourage them to keep pushing. But from your vantage point, actually both your vantage points, if you were to say, developers, please work in this area, work on X, or what would that be? What are some of the areas where you think not enough attention in healthcare is being paid attention to by people developing applications?
Well, I think virtually every area, and certainly I'd give the same advice I give to faculty, students, that is, work on what you're passionate on working on, because that you're going to have your greatest impact if you're really passionate about what you're doing. But I think to follow up on a theme that was discussed a lot in the last session, multimodal data. Health data is absolutely ripe for tackling the challenge of bringing in multimodal data. And yes, it's images that should be combined with language and text, but it's not just images, it's data from wearables and remote monitoring. It's our genetic data that increasingly is accessible to us. How do we bring all of that together to really get a comprehensive picture of our health, our propensity for disease, and in turn inform the type of preventative health care that we should be getting? In the United States, we have a great sick care system. We do provide, I'm convinced, for those who have access to it, the very best care for severe acute diseases. We have a very poor health care system that is at keeping us healthy for longer periods of time, preventing disease from occurring, or when it does occur, diagnosing it much earlier. And that type of assimilation of multimodal data in an AI setting is the way we're going to get to that end.
And I would say a huge and urgent market is actually elder care. So how do we care for our elderly? All around, certainly the global north, we have more old people than we have young people. So there's a desperate need, and I think AI can provide a huge help, not just in the last 90 days or keeping us healthy for longer, but also support enabling us to stay in our homes for longer, and not perhaps having to rely upon care homes in the same way.
Oh, that's wonderful. Well, maybe that's a good note to end on. Certainly appreciate your perspectives and thoughts. Please help me in thanking Kay and Lloyd for their perspectives.
Thank you.